This is my student support system. Keep watching, keep learning.
And what is leadership? Let us start. As you know, that leadership is a quality of a person or individual to lead the group or the team. Leadership is the activity of persuading the people to cooperate with each other for the achievement of a common objective or goal of the organization. Leadership is essential in every field, including nursing. Nurses not only provide care but also guide, influence, and inspire other members of the health team to deliver quality health care. Effective leadership ensures improved patient outcome in terms of health, better teamwork and communication, and professional growth and accountability in the field of nursing and healthcare. What is the definition of leadership? Leadership is defined as the ability to influence, to guide, to motivate the individual or the group towards achieving a common goal. Leadership in nursing means taking responsibility for the patient, coordinating with the health team, and promoting a positive clinical environment so that patients' health care is improved and outcome will be better. What is the importance of leadership in nursing? Sometimes this question comes in examination. So, main importance is that leadership or good leadership promote high quality patient care. It encourages professional development among the nurses. It improves communication and coordination between the health team and build confidence and morale of the staff who is providing health care to the patient. It also enhances decision making in critical situations. It improves working environment for the healthcare professionals and enhance positive outcome for the organization, patient, and healthcare providers as well. So what are the qualities of a good leader? Separate questions arises in the examination. Qualities of good leaders. So good leaders have self-awareness. When the leader understands and recognizes his or her strengths and weaknesses, the more effective he or she can be as a leader. Second quality is that good leader always show compassionate behavior towards the subordinates so that they work as a health team and work as a family. Good leaders have clear vision about the future and motivate others towards the vision. The best leaders have skilled communication. They are good communicators who can communicate with the health team members in a variety of ways, both orally as well as in writing and with a wide range of people. Good leaders have quick learning ability and have innovative ideas so that their goals are achieved easily. Good leaders are cooperative and are able to get teamwork from the subordinates. Good leaders also have problem solving ability and can solve the conflict among team members so that their team members cooperate with each other and achieve their professional goals. Good leaders have influencing ability. They are good influencers. They have ability to influence others to get work done. Integrity is again an essential leadership trait for the individual and the organization. And finally, courage. Courage enables both the team members and the leader to take bold decisions that move things in the right direction. So it is all about leadership, definition of leadership, objective or importance of leadership, and qualities of good leaders. So 3 or 4 questions can appear in the examination from this lecture. Thank you, students. Have a nice day.
My student support system. Keep watching, keep learning.